Tamika with me today. We're going to talk about nurse residency programs. This is a very exciting time in your life. You recently, well, when did you finish your or gotten your license and got through NCLEX?
I got my license. I graduated in April.
April.
I have to remember because COVID.
Right.
And then I got the NCLEX. Passed the NCLEX on June. I want to say June 9.
Okay, that's April, June, and then you started a residency program.
Yeah, I started the residency program. I applied to the residency program early, but because of, things I had planned throughout the year, they recommended that I finish with all my, plans. And then I applied again in December
Mm-hmm.
and did my interview in December and then got my first job offer and started in January with the program. Mm-hmm.
So basically, the timeline we're talking about is from like June to January, more, right?
Yeah.
Period. Perfect. And I know that you were working on mother, baby, and GYN post-op, or GYN, is
Mm-hmm.
that what you call it?
Or like women's pavilion.
Uh, Women's, good way to state it. And can you tell us if the nurse residency programs are only for specialty nurses, or are they for all types of nurses?
So the residency program is for all nurses. They give us the option of med surg, telemetry, ICU, mother and baby, L&D, emergency room, and I think there's more, but I'm not sure. I've only met the nurses during the program with the ones I mentioned.
Perfect. So basically,
Mm-hmm.
this is a program where they train new graduates to transition better and to become better nurses when they're actually starting to work. Is that right?
Right.
Alrighty. And tell me about how is it structured? How does it prepare you to be a better nurse on the floor?
So the first month was all classroom time. It was Monday through Friday. We'll go into a classroom and we went over like EKG. They told us to go get the BLS again and the ACLS. So they help us with that. And they also like went over some of the stuff that we already went through in nursing school, like, like glucose. I'm trying to remember some of the other ones that we did. It was a lot. They give us like little assignments, like little homework for us to do. So, but it's basically like not basically like nursing school where they're not like saying you need to do it or you're not going to pass, but it's just like a review basically. And then we had a week where we did skills where they try to, see where we were at with, Foley's, IVs, pumps, working the pumps. They drilled EKG in our heads, and all the other stuff that we learned in nursing school. And then we had another week where we did stimulation, where we went to a facility and we did that for a whole week where they gave us scenarios to see, basically prepare us, help us kill patients before we, before we had to deal with real patients. And that was it.
Okay, and the skills checkoff that you were talking about, is that done on mannequins or is that's done on real patients?
Done on mannequins. Because of COVID, we weren't allowed to do it on people. I mean, we were still a big group. I believe it was like 70 or 60, but they didn't want us to like practice on ourselves. I think the only time that we practiced on ourselves was doing a full body assessment, but it wasn't really like in detail because of COVID, of course.
I see. Perfect. Well, thank you for sharing that information. That's actually very interesting. I did not know that there was also a skills part and a simulation part. That's actually something
Yeah.
maybe also new that they've added to the program. And last but not least, I would like to ask you about your personal struggles through this transition from being a new grad to becoming an RN on the floor? What do you
So
have to deal with?
I want to say my struggle is time management. I didn't know that I didn't have time management skills until
So
I'm not really on my own, but because my preceptor, she, you know, how she structured her, you know, not really lesson plan because she's not a real teacher, but how she structured what she wanted me to do. She had me do things on my own way before like beginning. So I didn't have to wait till the very last, you know, weeks of my preceptorship for me to, you know, do everything on my own. But time management, like having patients on your own and trying to provide care equally is hard, especially.
not only that, you have to chart everything that you
And then you have to chart, and it's crazy. Like I know that they say nurses that they don't eat and they don't pee. Like it's for real. You don't have time to pee. You don't have time to eat. But I think time management is the biggest struggle from where I came from, you know, sitting down at a desk till being on the floor.
to being on the floor. I think that's one of the struggles that a lot of us face when we start and when we are trying to become new nurses, when we're going through that transition of, you know, from a caterpillar to a butterfly and trying to fly on our own. Um,
Mm-hmm.
but we all make it. We all make it sooner or later. You'll get your system together. You'll know how to deal with, you know, the assignment that they give you. It just
Hopefully.
practice. We know you will. You will. Takes a little practice, and as you go along you figure it out and you're like, okay, well that didn't work last time, let me try it this
Yeah. Yeah, definitely.
so yeah. And you know, tips from more seasoned nurses would also help. I know some of our nurses on the floor would, like, the first thing they do after they get report, they rush into that med room and that's all they get, you know, they get all their meds up, you know, in the and then check, okay, I got all my meds for, you know, for the first half of the day, and they're ready to go. Or some of them would do all of their assessments first, you know, do all of the assessments while they're doing handoff report and then chart it right away. And that was
Mhm.
the day that they did. So whatever works for you, you know, you would have to find your own style of nursing, but I think you're not alone in that struggle. It's
I know it is a true struggle though.
Well, I do thank you for your time today. Thank you for sharing your experience. I
No problem.
find it very interesting and helpful.
Not a problem.